Welcome to WBR's Health Journal Television. I'm Alexander Haig, inviting you to join us as we explore the frontiers of healthcare and medical technology.
Explore applications of technology in medicine. See how experts prevent, diagnose, and treat today's most traumatic illnesses. Discover the latest breakthroughs in healthcare on World Business Review's Health Journal Television.
The medical profession is facing a critical shortage of doctors and nurses. Let's take a look at how TravelDoctor.com is injecting fun and excitement into the medical profession while filling this serious need.
From America's heartland to bustling metropolitan cities, the demand for medical professionals has reached a fevered pitch. This nationwide problem has led to a wealth of opportunities for doctors and nurse anesthetists alike who want to see the world. The real winner in this equation, however, is the medical facilities.
Worldwide Medical Services has helped provide us physicians and other healthcare providers on short-term notice for the last 3 years. By fulfilling our needs, we've been able to serve our clients, the employers, better and ultimately fulfill our mission to the community.
Here, the secret to success is a national database of medical professionals. This means a hospital in Clear Lake, California, or a clinic in Miami, Florida, can find just the right doctors they need.
The physicians that Worldwide Medical has provided for us over the last several years have either met or exceeded our expectations. They've allowed us to maximize the productivity of our clinics and meet our obligations to the communities that we serve.
But placing these doctors in a timely, cost-effective fashion is far from easy.
I work with Worldwide Medical for the last 3 years. Some of my radiologists are staffed by them on a weekly basis, but some others are on a very, very shortened notice. And since we staff a trauma center, so the radiology coverage is absolutely mandatory. And so it's necessary for patient care, and it helps the bottom line too.
While the medical facilities themselves receive a trained professional ready to hit the ground running, at the same time, the doctor or nurse anesthetist receives travel benefits and excellent professional fees.
Hi, Nadine. Hi. We've got Dr. Brown. He's ready to go to work here for us. We need to put him under our professional liability insurance. Definitely is an advantage for our doctors and CRNAs to be able to get daily insurance on the spot in all 50 states. And our clients are assured then of having a pre-qualified and fully insured professional to help them on the spot in relatively short notice.
Hospitals, group practices, and clinics have a real incentive for filling vacancies quickly. There's a danger of losing patients and also income through inadequate medical manpower.
I think a major challenge in radiology field nowadays is the advance of technology is way ahead of the training of personnel, including both radiologists and technologists. It's difficult to find quality radiologists who is competent in most imaging modality. And I have been very lucky with TravelDoctor.com because they have been able to staff me with amazingly large number of good locum radiologists for what I need.
By utilizing this program, valuable time and money can be saved by immediately going directly to the source of manpower and eliminating a time-consuming search for the right physician or nurse anesthetist to staff vital vacancies.
In my professional opinion, there is a large shortage. First off, there's a lack of people being trained right now because fewer people are going into the field. Secondly, malpractice is really high in a lot of states, causing people to relocate to different states where it's more reasonable to practice.
Working with Bay Area anesthesia has allowed me to achieve some of my professional goals in terms of travel, in terms of meeting a different medical population while I travel. and honing my anesthesia skills to match that population.
If you're wondering why we have such a shortage, experts say it's because of staggering medical malpractice premiums. Doctors have been forced to make the difficult choice to stay, and if so, to go out of business, take an early retirement, or relocate to a state with more affordable premiums.
In medicine today, we need more than ever good, qualified people to deliver high-quality health care. But many of the regulations that surround the system, that is, the healthcare system today, make it harder and harder to attract quality people and to retain them in the industry. And other outside influences, such as the malpractice insurance crisis, make the cost of doing medicine today much greater than it was before. So hospitals and healthcare systems of all kinds face a much greater expense to deliver the quality care they want.
While the need for qualified doctors and nurses continues across the board, some specialists are in particular demand.
Over the last 35 years, since 1969, I've been providing locum tenens, or temporary doctors, to hospitals and clinics, offices nationwide. During those years, we've found that there have been needs for all types of doctors, but right now we're getting the most calls here at traveldoctor.com for radiologists, anesthesiologists, and nurse anesthetists, CRNAs.
The reality is the medical staffing shortage is only going to get worse before it gets better. In the meantime, doctors and nurses with a wanderlust are taking advantage. The Chinese symbol for crisis is opportunity blowing at an ill wind. For medical facilities savvy enough to rely on expert recruitment, a potential crisis has indeed turned to opportunity. For Health Journal Television, I'm Paula Melly reporting.